Let's look at some organizations that are important to all labs, and therefore the healthcare workers who work in them. Clinical and Laboratory Standards Institute is a nonprofit organization that develops a consensus to find standards and guidelines for laboratories. These guidelines are used in over 150 countries for best practices in the laboratory. In phlebotomy, the CLSI defines order of draw, or the order in which tubes are drawn on patients to ensure the highest quality of results. They establish standards for collection techniques, tube handling, blood culture collection, specimen labeling, and sets quality control measures like accuracy and reliability of testing procedures. The Centers for Disease Control and Prevention, known as the CDC, is a government agency in the United States that helps to protect people from health threats, manage outbreaks, research diseases. This includes, but is not limited to, saving lives and protecting people from health threats, conducting critical science to understand diseases and health threats, providing health information to the public and healthcare professionals, responding to health emergencies at home and abroad, promoting healthy behaviors and safe environments, keeping track of health trends and identifying causes of health problems, working with state health departments and other organizations nationally and globally to prevent and control diseases. With respect to phlebotomy, it sets infection control guidelines, especially related to PPE, provides bloodborne pathogens standards, backing OSHA, and promotes vaccination recommendations for healthcare workers. The FDA is the Food and Drug Administration and is responsible for determining the complexity of tests. This is very important, as different healthcare providers are able to do different complexities. They are classified into 3 categories of tests called waived, moderate complexity, and high complexity tests. Let's take a closer look at each of these levels of testing and who can legally do each of these categories. Waived tests are the lowest level of tests with the least risk of error associated with them. These are the kinds of tests that you might see done in a clinic, a doctor's office, or even a pharmacy. These might include home pregnancy testing, urine dipstick testing, fecal occult blood tests, erythrocyte sedimentation rates, and microhematocrit tests, to name a few. For waived testing, things are pretty open. Lots of different people can do these tests, as long as they follow the manufacturer's instructions. That includes doctors, nurses, medical assistants, pharmacists, and many others, depending on state law and facility policy. Sometimes even people who aren't traditional healthcare providers can do waived tests if they're properly trained and supervised. The main idea is that these tests are simple and safe, so the rules are relaxed. Moderate complexity testing requires some lab equipment and often more training than waived testing. The FDA looks at how complicated the test is to run, things like how much training you need, what kind of equipment you use, and how tricky it is to read the results. If a test scores low enough on their checklist, it gets put in this category. Labs that do moderate complexity tests have to follow more rules, like doing regular quality checks and making sure the people running the tests are properly trained. Examples of these tests include complete blood count testing, chemistry panels, and provider-performed microscopy tests. When it comes to moderate complexity testing, the rules get a little tighter. Doctors, dentists, podiatrists, and people licensed to work in clinical labs can do these tests. Some mid-level practitioners, like physician assistants or nurse practitioners, can also perform moderate complexity tests if they're allowed by state law and supervised as needed. There's also a special group called provider-performed microscopy procedures, which are a subset of moderate complexity tests that certain providers like doctors, dentists, and mid-levels can do during patient visits. High complexity require a lot of skills to read these tests and specialty equipment to obtain the values. They often also involve a lot of specialized training to obtain these test results. Labs that run high complexity tests have the strictest rules of all. They need to be extra careful about everything from how they handle samples to who is allowed to do the testing. These are the kinds of tests you'd see in big hospital labs or specialized clinics, where accuracy is super important and mistakes could have serious consequences. Examples include cytology tests, such as pap smears and genetic testing. High complexity testing is the most strictly regulated. Only people with specific education and training are allowed to do these tests. Doctors, clinical lab scientists with advanced degrees, and people with specialized lab training and certification can perform high complexity tests. Nurses, for example, can do high complexity testing only if they have extra education and hands on training in the specific area being tested, and only if they already had this authorization before recent rule changes in some places. CLIA stands for the Clinical Laboratory Improvement Amendments. This is a law that was passed by Congress in 1988 and has had necessary updates as needed. The Act establishes quality standards for the laboratory. It ensures reliable and accurate results. It monitors and inspects labs, provides resources, creates the classification of lab tests into 3 categories, and includes personnel proficiency testing. How do the two differ? The FDA determines the rules of classification, while CLIA puts a test into a classification once it has been approved for use. CAP, or the College of American Pathologists, is the leading organization for pathology certification. They are responsible for accrediting and inspecting laboratories to the highest standards. The TJC, or the Joint Commission, is an independent nonprofit organization responsible for accrediting and certifying healthcare organizations and programs in the United States. They set national patient safety goals and advocate for patient safety practices. Ignoring these testing standards isn't just a minor oops, it can lead to serious consequences. If someone performs a test they're not qualified for, the results could be inaccurate, which puts patient safety at risk. Think misdiagnosis, delayed treatment, or even harmful interventions. On top of that, the healthcare facility can get slapped with fines, lose accreditation, or face legal action for violating CLIA regulations. It also puts the healthcare worker's license or job on the line.